Alright, in this video we will be studying about the Broca's aphasia. Broca's aphasia is basically the involvement of the Broca's area. Broca's area is located in the inferior frontal gyrus, right? If this is the brain or the cortex, this is the central sulcus, and this is the frontal lobe, and it is divided into three areas: superior, middle, and inferior frontal cortex. Inferior frontal cortex has Broca's area, and middle cerebral artery divides into superior division and inferior division in the central in the sylvian sulcus, sylvian fissure. So the involvement of superior division of middle cerebral artery may cause stroke of Broca's, because stroke, and this stroke will have Broca's area involvement. Broca's area is basically Broca's aphasia is basically a disorder of speech, a disorder of language, in which the patient is not able to, express the thoughts in the words. The patient is not able to make the words. The motor part of the speech is involved basically. Otherwise, comprehension is intact. The patient is very fluent. The patient is the patient is non-fluent, but the patient will try to express in some meaningful words, but the words will not be very much clear. So the clarity of the words is lost. So it is basically very much similar to dysarthria. So speech is non-fluent, speech is very much labored, speech is interrupted by word finding pauses, and it is usually dysarthritic. Dysarthria will be there because the motor component of the speech is impaired. In addition to fluency, naming and repetition are also impaired, right? It is impoverished in function words but enriched in meaning appropriate nouns, right? Speech is telegraphic and pithy but quite informative. Let me give you an example. A patient with Broca's aphasia describes his medical history. Suppose I am the examiner and I ask the patient that what happened to you. I ask him about his history of his medical illness. The patient explains, I see the daughter. Daughter sent me boson. Go to hospital. Daughter kept me bedside. 2 days. Daughter sent me home. Though we are able to make the scenario out of this speech, out of this sentence, but it is not very much clear. It is not to the point. Though we are able to decipher some meaning from it, but it is not how it is meant to be. So output may be reduced to a grunt or single word. The patient may either grunt or may just say yes or no, which is emitted with different intonations in an attempt to express approval or disapproval. So this is basically a way of expression. Because the motor part of speech is involved, the patient will adapt to some grunting, some different intonations to express his feelings or express his thoughts. So comprehension is intact, right? Comprehension, the patient is able to understand what is happening in the environment, what is happening around, but uh, he is not able to make the words. Comprehension is intact, but the syntax is impaired. Means the way in which a sentence is made in a language, the that syntax is lost. Patients with Broca's aphasia can be tearful, they can be frustrated, and they are depressed because insight is present. That is why the patients are frustrated. Why they are frustrated? Because they know they are ill, they know that they are impaired in their language. They were normal a few days back, stroke occurred, and they are suddenly not able to speak. So that makes them very much frustrated, and that makes them very much depressed. Insight to their condition is preserved, in contrast to Wernicke. In Wernicke, the patient was angry that why the other person is not understanding my language. I am perfectly fine, the examiner is not able to understand my language. Wernicke's if his insight is lost, the patient feels as if he's all right. but he is not aware of the deficit he is having. But Broca's aphasia, in Broca's aphasia, the patient is very much, he is very much, he knows about his illness. So that is the presentation of Broca's aphasia. What is the etiology? The cause is most often the infarction of Broca's aphasia. Infarction of Broca's area, sorry. Broca's area is present in inferior frontal convolution and surrounding anterior perisylvian and insular cortex due to occlusion of the superior division of the middle cerebral artery. Yes, that is what we have just discussed. Mass lesions, tumor, cerebral hemorrhage, abscess may also be responsible for the damage to the Broca's aphasia. What is the prognosis? When the cause of Broca's aphasia is stroke, recovery of language function generally peaks within 2 to 6 months, right? Within 2 to 6 months, the patient may recover to some extent, after which the progress is limited. But very important, speech therapy is very much successful in Broca's aphasia, although it is not successful in Wernicke's aphasia, but in Broca's aphasia, because in Broca's aphasia, motor neurons are lost, and we can train other motor neurons to perform the same function. So that is why speech therapy is very much successful in Broca's aphasia, but in Wernicke's aphasia, it is not that much successful. So that is all about Broca's aphasia. I will be coming up in the next video uh, with other aphasias, maybe transcortical aphasia, right? So that is all about this. Thank you so much for your patience.